Okay. Appreciate you guys being patient while we do the very typical EM thing of changing stuff at the last minute. My name is Rama Salhi. I am a health services researcher at MGH. I'm here with my esteemed group of colleagues. Thank you so much for showing up today on like the last day of conference at 9 a.m. I know like lots of us have things to get ready and head out of town, so thank you for being here. Just to briefly start, so we will go ahead and introduce ourselves, and then we'd like to quickly open it up to the group to hear what you all were hoping to get out of this, because we certainly have things that we think are sort of important in terms of foundation and getting everybody like familiar and comfortable with the idea of qual and like the basic foundations of qual. But if you come to this with a very specific question or even a general question, we'd love to hear it so that we can help kind of spend more time in those moments. So again, my name is Rama. I work at MGH. My work focuses on the intersection of structural inequities and the delivery of acute time-sensitive care. And am probably, definitely, the most junior person on this panel, so I appreciate them being patient with me. Go ahead.
We are not going to go in terms of who's most or least junior, so I'm not going to go with that precedent, but I'm Bisan A. I am an emergency physician and anthropologist. I am currently the Student Affairs and DEI Dean at Drexel, and my research looks at the intersections of homelessness and emergency medicine, and particularly how homelessness is a mechanism, or housing, excuse me, is the mechanism of structural racism and inequality in the United States. So.
Aasim I, Padela, the Medical College of Wisconsin, where I'm the Vice Chair of Research and Scholarship. My work is very wide-ranging, but I use qualitative methods to think about how we accommodate physician identities within the house of medicine, and then qualitative work to understand barriers to healthy behaviors amongst Muslim communities in the United States. So I hope that suffices.
And my name is Ambrose Wong. I'm an assistant professor of emergency medicine at Yale. I'm also a health services researcher, and I look at the intersection of DEI, equity, and mental health crisis. And then Elizabeth?
I'm Elizabeth Schoenfeld. I'm the Vice Chair of Research at UMass Bay State, and I have used qualitative research to understand perspectives of physicians and patients, starting buprenorphine and methadone in the emergency room, as well as other stuff on the same thing, physicians and patients and shared decision-making. And I'm the decision editor for qualitative methods for academic emergency medicine.
Thank you. So before we kind of go ahead and as we're kind of figuring out our slides, we were hoping to kind of open it up to y'all just to see what you're kind of hoping to get out of this session, just to see if we can kind of address some of your questions as we're going along to kind of make it more relevant. So.
Right in front of you is a mic. So if someone wants to say what they're hoping to get out of it, you're not going to spend much time on it, then use the mic.
Thanks so much. Well, I kind of just wanted to know, so I've been to a couple of these, and every time I come to SAEM, like my understanding just gets better and better, so thank you for doing this. I just want to get a better idea of like how to do the data analysis, like the coding and data analysis. I think that's where I get stuck. I'm a primarily quantitative research, but like I'm the only PhD in my department, so everyone comes to me with research questions. So like I'd love to be able to know like how to do the data analysis for this, because I can be helpful to a lot of people if I can.
I was curious about a couple things. The first was just about the way you structure your questions. Some of them are story-based, some of them are just asking open-ended questions, just the different techniques there. The second is actually more about journals. So like what kind of reporting requirements there are for journals. There's different checklists, if you recommend that we do that.
I've been recently dabbling in the qualitative arts, and I'm trying to figure out how to, like a good resource for figuring out the conceptual framework, like the idea of like however you're going through the questions. I've been trying to read papers and then figure it out, but it seems like there's multiple different ways to describe the same conceptual framework, which I guess is kind of fitting, but how do I figure out what I'm doing and put a name on it kind of thing?
Unfortunately, I'm going to have to leave, but I'll listen to the recording. But one of the things that I'm interested in is trying to speed up the process of the analysis and so that we can get information out quickly, and both for our own productivity and also to disseminate the information quickly, and some of what I'm working on more is more of a cross between action research or mixed methods, or a rapid cycling of qualitative data with a team-based approach. But other suggestions or tips for that would be something that I'm interested in. If you could.
So that's great. I will hand it over to Dr. Salhi. I would just like to briefly give a shout out to Dr. Schoenfeld, who has shepherded this process as well and has done a number of the workshops in the past. And much of some of the slide content and the structure has been due to her prior work. And so I just wanted to say thank you.
It sort of sounds like next year we need to have like a Qual 201, because it sounds like a lot of people have started doing it or have the basics, and maybe need both.
Yeah. Thank you all for those great questions, which we hope to address soon or in the coming slides. For those of you who are new to qualitative research, I just want to start with a basic definition of qualitative research, which is a scientific method of inquiry and observation that focuses on non-numerical data to understand the quality, manifestations, and context and phenomena of interest. I had an advisor who would say that quantitative researchers like to describe the world using numbers, and qualitative researchers like to describe the world using words. And I think that that is a really good, quick shorthand, but I also just want to point out that qualitative research can encompass so much more than words, which is including like sounds, the music, photos that people take, drawings, and so it's really just a very broad world of research and inquiry. But qualitative methods are really ideal for understanding dynamic and ongoing phenomena or processes, better characterizing specific topics that may be sensitive or emotional or morally laden for people, and helping to understand human behavior with all of its complexities and contradictions. The other thing that I just want to stress as well is that qualitative and quantitative methods, while they can sometimes be overlapping and very complementary, start from very different suppositions and desires to kind of understand the world. So whereas quantitative research seeks to quantify or measure differences in incidence or prevalences, and kind of really is focused on cause and effect, qualitative research is much more exploratory, looking at observation and interpretation of particularly kind of human processes. Similarly, when looking at hypotheses, generally qualitative methods are more focused on hypothesis generation, but they can definitely be hypothesis testing. Similarly, quantitative methods can be either hypothesis generating or testing. Sampling in qualitative research is usually small and purposive is just a very, I think, fancy way of just saying non-random, if you're actually like looking for a specific group or population, whereas quantitative research is much more large and representative of kind of like bigger populations. The data for qualitative research tend to be focused on observations, discussions, and interviews, and is much more open-ended with the idea of actually gathering from informants, whereas quantitative research, as you all know, is measurable outcomes and data points and is much more discrete and operationalized. The analysis, as you all asked about in qualitative research, is iterative, is focused on coding of data, the interpretation of themes, concepts, and relationships, whereas quantitative research is determined as usually a priori and is much more statistical. I will also say, just in relation, in response to the question about kind of analysis and putting a name on things, as often if you actually read what people do, there is in fact a lot of overlap, but the names that people actually ascribe to their analytic methods tend to come out of different disciplines and have a lot of like historical, just historical background. And so, for example, as an anthropologist, I will tell you like that if you actually like, I know that if I'm, going to grounded theory, like I know like that I'm going to like, to Levi-Strauss and kind of going back to that. And that's sort of the thing that has kind of evolved, and that was sort of the first use of that method. And so if you actually look at it, it's not necessarily like a lot of it is philosophical, historical, and disciplinary differences rather than actual differences in what people are doing day to day. So I just want to kind of give a shout out to that. I think that there are similar things in quantitative methods as well that I cannot point to nearly as well. But I think what is also important to realize is that often I think qualitative methods can be just as rigorous as quantitative methods, but the way that rigor is achieved is through is not actually in the interest of actually achieving kind of non-objective or excuse me, I just spoke that all wrong. That rigor in qualitative science is not achieved in the interest of objectivity. Rather, it is through the recognition of the fact that objectivity does not exist in human behavior, and that actually, rather than kind of trying to eliminate our bias, that we recognize and discuss it, and we are open about it, and actually like trying to actually name it so that we know the way that it influences our analyses and our methods and the way that we view the world. I would argue that also there's no such thing as objectivity, but that is a very different talk for probably for a different time. So that is the other thing. So just to kind of give an example of some of the differences in qualitative and quantitative methods. So some of the ways that a qualitative researcher might approach a question would be, what are the barriers to patients with substance abuse getting buprenorphine? In contrast, a quantitative researcher might ask, does getting a script for Percocet increase the chance that someone will end up with a substance use disorder, right? So it's a much more discrete, operationalized question. Similarly, like why do doctors order CTAs for PEs before getting a D-dimer in low-risk patients? So much more open to a variety of answers to that, as opposed to a quantitative counterpart, which is how often are CTAs ordered in low-risk patients when a D-dimer was indicated by guidelines. Similarly, you can ask, how do doctors feel about shared decision-making in a qualitative research study, whereas in a quantitative research study, you could ask if the use of shared decision-making by a patient will make a patient less likely to sue a doctor. So we're going to start just kind of delving into the methods from start to finish. Obviously, the first thing in any research project is to actually formulate a meaningful, good question. And then to choose a framework or a theory, followed by kind of discrete methods and sampling and analysis, and then interpretation and discussion. In kind of thinking about the question, it is really important in qualitative research to start with very broad with a very broad kind of basis and to avoid assumptions. And the reason you want to avoid assumptions is because sometimes actually you can, by the avoidance of assumptions, you can actually gather like really rich data that can be very meaningful in your discussions and analysis and can actually also inform really important research questions later. So actually particularly thinking about informants and participants' priorities. So for example, if your goal is what are the barriers to patients with substance use disorders getting buprenorphine, we also realize that that is a very difficult question to actually like ask a person, and they may or may not, they may interpret it very differently or just kind of look at you with their eyes glazed over. A much more fruitful question would be, how has your experience been in getting buprenorphine, and what factors did you consider in deciding to start? In response to kind of the audience question about how to ask a question, I also want to point out In my mind, there are a lot of parallels between qualitative research and clinical practice, in the sense that that if you're asking about, say, chest pain, that your history taking and the way that you ask a question is going to be very different if you are talking to somebody who is a physician versus somebody who, is a child or has like a different background. And so you have to kind of phrase your question appropriately and be ready to also sometimes be flexible in your wording in a way that respects and follows like what people have already said to you, so that is a way to kind of be flexible in it. The other thing I want to point out is that the question you ask is really important, but so is who is asking the question and where are you asking the question. So we all know that people are more likely, or we all, and this is just human behavior, will divulge different information to our family members than we do our colleagues, than we do people in power, than we do our therapists. And so it's really important, that's kind of part of the reflexivity. And when you're kind of deciding not just who's going to ask not just what question is going to be asked, but also who is going to ask the question in a way that makes people feel comfortable and feel comfortable to talk, and so that you can actually get really meaningful data. So it's really important to be aware of all of those nuances. Similarly, if you're asking a question, if I ask you a question in an audience, I'm probably going to get a very different answer than if I'm asking you a question in a very private setting, or if it's on Zoom, or if it's recorded. And a lot of these kind of have to do with like really knowing the participants in the audience. So my personal focus, like I said, is on homelessness. And so I noticed when I was doing a lot of my research that they were really averse to actually having their voices recorded, like some of my informants. And so you have to kind of be flexible in kind of gathering the data, interpreting it, and like being flexible with your methods so that you're actually like gathering, being respectful of informants' needs. And so I will stop there and hand it over to my colleague, Dr. Wong.
Thanks, Bisan. Really well spoken. I just wanted to add that your analogy about mirroring clinical practice is so true. As I'm thinking about it, I'm probably going to borrow that because it does. In addition to what you said, I think the other thing about asking questions is that the way you ask the questions or how you word it can also guide or lead the conversation. And so you do want to be really careful about how you phrase things or what exactly you ask. Like even with chest pain, you say, tell me about your chest pain versus is your chest pain sharp? Did it happen before you woke up? Because you're thinking about those things, but then you're kind of guiding them towards a PE rather than ACS. So I think that's a really great analogy. So there was a question in the back about theoretical frameworks. I'm so glad we read your mind. But it is a very key important part about thinking about qualitative research. And I would say that most reviewers on grant panels and for manuscripts will expect you to have some description or some thought about theoretical frameworks, and will challenge you to express or explain yourself if you don't talk about it in your manuscripts. And I would say the reason for that is because the way that qualitative research works is that you are thinking about interactions of concepts and how things relate to each other, and the way that it's driven by how you think about those relationships will drive how you ask the questions. So they want to know, are you thinking about it from a social sciences perspective? Are you thinking about it from some sort of deductive method? And so these frameworks are really, really key. I have to say, as a clinician, training in medical school, not necessarily having a social sciences background, I knew nothing about what the hell that meant, when I started research, let alone qualitative research. And the thing that I have found to be most helpful is to partner with folks that have expertise in social sciences. That's really, I found, the best way to learn about theoretical frameworks and how that works. Because I think, like you said, there's thousands, I don't know, maybe hundreds of thousands of theoretical frameworks out there, and each field has their own, and there is just no possible way that you can feasibly know all of them. And the power of doing team science or transdisciplinary science is that you can actually work with individuals who have expertise in those areas, and then you sort of complement and pollinate, each cross-pollinate. So I think that's really how I found it to be most enlightening and exciting. And then over a couple of times of different projects, you start learning those theoretical frameworks and you apply them in different areas of research. And I think that's really what's exciting about qualitative research. So long and short is that frameworks just help you sort of create a structure for how you're thinking about your research, and it helps you think about how you're going to ask the questions and how you're going to create your research plan and your analysis. And also the question is, why does anyone care about your question or your project? Why does that have any meaningful impact on either clinicians or patients, or why do they can publish your work? And so that's sort of the driver for why you might want to necessarily ask about that question. The other thing that's exciting is that the frameworks help you think a little bit about applying your questions to certain areas of work, and the framework can help you just frame the question so that you really focus on a particular thing that you think you're interested in, and that you may then decide, you know what, those questions are not valid because the framework does not apply in this case. So it's almost like helping you contextualize the questions, which is really exciting. And we do have just a couple of examples of theoretical frameworks that exist. The Institute of Medicine, for example, has this very complex but really great theoretical framework here about diagnosis linking to outcomes. Things that I've learned is that the best way is to either apply, adapt, or directly use frameworks that have already been published, because then you don't have to start from scratch. You can cite it, and people have already spent countless hours to create these frameworks and have done a lot of evidence behind it. And so that's ideal if there's already a framework that you can borrow from. Sometimes that doesn't always happen, and so then you may want to propose a novel framework, or maybe using grounded theory or another technique, you may actually develop your own novel framework, which is the most exciting but the most challenging. Here's another example here from NCI that's talking a little bit about the linking between external work to how people have behaviors. This is sort of like Theoretical Frameworks 101. And I would say, again, when you're writing grants and putting papers together, before you even potentially even start thinking about how you would ask the questions, I would dive into the literature and try to figure out if there are frameworks that already exist in the world. And again, talk to your social scientists, because a lot of times they'll have already some expertise and can tell you what frameworks and guide you to get there. So once you have some frameworks in place, or at least a thought about the frameworks you might want to use, that will drive a little bit of the techniques and the methods that you might use to actually collect your qualitative data. So the exciting thing about qualitative research is that you actually have a number of different ways to get your data. And like Bisan said, these are ways to potentially get words or text, but the other exciting thing is you can use sound, you can use other ways, you can use visual aids to help you think about your qualitative data, and you can still gather them in all these different ways. So these are sort of the three most sort of basic fundamental ways to gather your qualitative data. The first one, which in some ways is actually, in my mind, the most difficult, are observations. So you are next to the person, the individual, or groups of individuals, or the parties you're interested in, and really taking detailed notes about what is happening and what you're observing. And so the most important thing, like Bisan said, is to be very mindful of who you are as a person, as a researcher, because that will actually drive the way that you're taking notes and observations and how you're viewing the world. And also the frameworks will help you, because that'll also drive what things you're trying to pull. You could write, like things you're thinking about, maybe an observer taking notes right now for us doing this presentation. That might be a research they may be asked. How are emergency physicians teaching about qualitative research in an academic emergency medicine conference? That might be a question. And so they can take notes about my body language, how I'm standing, how are people in front of the room, how are people nodding or smiling, who are the people in the room, what is the race and ethnicity mix of the people in the room. And so there's a lot of things you can take notes on, and depending on what your question, it may feel and change the way that you're taking the data and what data you're taking. So like we say on the right, it is very time consuming, and potentially you do need to involve the stakeholders so that they let you into their space and trust you and agree with you to be there as a observer. The other thing is that sometimes the observations alone may not be enough, because you also need them to explain or contextualize what you're seeing. And that's sort of where the other two pieces of data can also help you complement. Individual interviews are sort of qualitative research data collection 101. The really nice thing is that you get really in-depth analysis from one individual person who may be a very important key stakeholder or someone that has very key information for you. The counter to that is that, of course, you're getting one person's perspective, which is really key but may not necessarily be enough, and you have to do a number of interviews and potentially really 25 to 30 to really get what we call sort of data saturation on average. Focus groups are ways to complement that. You get a lot more people at once, sort of bang for your buck, so to speak, because you're getting a lot of different people and potentially differing opinions. But there are some psychology things that drive focus groups. They tend to want to agree with each other. You start developing consensus towards the end of the focus groups. And you also want to think a little bit about power dynamics. Some folks who may be in a little bit higher position of power within the focus group may dominate the conversation or overrule people who might be in minority positions of power within your group. So you want to be very mindful of how you're setting that up, who and how many people are in the room, where you might be actually conducting the focus groups and so on, just to make sure that you're getting really as much data as you possibly can. And the nice thing is that you actually can mix and match these different types of qualitative data collection within one project. Being mindful that you have to then think about how you're going to synthesize the data in a meaningful way and make sure that you're getting value out of that. But they can enrich each other, and you can do them in conjunction with each other within one project. I think you're next.
Thank you. So we're going to kind of move now to theory into practice. I will say, and I like to comment there, that when I was a novice researcher, I had 3 different mentors who were talking to me about qualitative methods. And each one of them pointed me to different people, Miles and Huberman, Strauss and Corbin, or Cresswell. So there are camps in that. And so within my moving from theory to practice, I'm going to kind of give you a synthesis of these different views. But be mindful when you go and find a mentor. They might have a specific discipline that they're from, and will say this is the only way, but there is never the only way, right? So just a little caveat. So the question was asked, how do you move forward? And so I'm going to tell you how to move forward practically after you've thought about where you're going to be interviewing, how you're going to interview, what questions you have. So, but the first thing to think about from my standpoint is how you're going to develop your interview guide, right? Someone asked about questions. And so I would say, simply speaking, specify the phenomenon that you want to understand, right? Ask about the deep questions that are involved within that. Think about how, what, when, what do you want to describe? Because the first idea is, let me describe what's happening in the world, but think about that before you start putting any questions together. The second aspect of that is then thinking about the theoretical frameworks you heard about. Oftentimes, we don't recognize that the way we want to ask a question actually is not conceptually mapped onto something that you can actually describe within the framework. So I think this match between the things you want to describe, you sit alone and say, what do I want to understand? Then go find a theory, not the other way around. I want to find a theory and fit my questions to that. And then that helps you think about your interview or focus group guide. I will add one thing that you mentioned. There's a real issue about unit analysis. A lot of times people think, I have focus groups, I have more people, that's great. But your unit analysis is that one focus group, but it's not the people within them. So don't think you have more numbers because I'm going to do focus groups. You might be better off doing more in-depth interviews than doing multiple focus groups. And then for coding and analysis, right, the practice of that, these domains of interest that you have, right, those things you're trying to describe, set up what I would call, or others call, the frames upon which you're going to now think about your codebook development. I'm going to get into that in a couple of slides, but I'm giving you a practical way. Look at your questions. They're going to set up the frames, then you're going to think about how you code them. So the last piece of this slide says to think about that you can always have this notion of emergent codes or emergent themes. So there are things that we think we know about the world, but we'll find things when we do interviews that we didn't think about a priori. That's actually the beauty of qualitative methods, that you can add on other frames or other codes as you move forward, right? So they're new phenomenon, emergent phenomenon, that's the term, and that you're going to use them to help you think about where you want to explore. And I'll also give you another idea that when you think about saturation, you have to be very key about what you're thinking about in terms of new codes, new ideas, new themes, or the ones I start off thinking about. So some pro tips in terms of an interview guide. I actually talked to a colleague in the room about that a few days ago. So funnel technique is one technique. So you think about going from general to specific, right? General ideas everybody can answer, to more specific things about individual stories. Something that's easy to answer in the beginning to something that might be controversial or require them to reflect upon their experience at the end. And then something about other people. It's easier to talk about other people. I've seen people do this than to talk about myself sometimes. So these are some pro tips. Start off in that way, so establish a rapport, then get to the things that you really want to have them think about. And then, right, you want to always close with the back end, right? Something very open-ended so they can feel comfortable again, right? And reflecting upon the field or reflect about something else that allows them to feel that this was a way for them to give their voice to you directly. And then in terms of refining your sort of interview guide, as I mentioned, you know, if a question doesn't work, you can discard it, right? And if you find something that's interesting, you can add it to your subsequent interview guides. This is the beauty of qualitative methods. So here's an example, and I'm going to show you those best practices, an example of a study of mine. This is an interview guide from my study of Muslim physician experiences in academic medicine. So there are two domains here. I'm going to kind of point out this idea, and I'm going to let you read it. I don't want to read it for you. But you'll see in the beginning of this domain, right, that red box, I start out with general questions. Then I move to more specific questions, right, about their experience. And the frame, as I mentioned, is that one idea, right? I want to understand kind of their identity and how it manifests in practice. So that's the frame upon which I want to build all my codes. You'll notice that there's another frame, right? These are the concepts that come out from thinking about what I want to describe. There's theory there, but I won't put that on the slide. It would have been too busy. But then these are the theory codes. So when you think about, okay, how does one's identity, religious identity, influence practice? Well, we think about religious identity manifesting in 3 different ways. Practices, observances, right? And so that's where the theory comes in at that second level. For me, it did in this case, right? Someone could have said, no, the theory comes up at the beginning. But nonetheless, you see how you go general specific, you have a frame, and then you have your theory-based codes. And I might add on questions, as I did at the end, that comes up from something a participant said that I hadn't thought about when I made the interview guide, right? So this is just practice. All right, so now here's that example, right? So I found later on, we developed a code book based on the frame. You see that religious identity and practice at work. And then we found things people were talking about how they manage their practices. We had no question about that, no a priori code about that, but we found as people spoke about their practices, these were the emergent codes, right? They were doing different things. They were not managing, they were self-managing, the peers were helping them manage, or the institutional had a policy about how to manage your prayer at work. So then we added that into our code book. So what I'm showing you in the first slide was my interview guide, and the code book sort of mirrored that, but I added another layer where these are specific codes that came out of what people's experiences were. So that's another way to think about linking things together, theory to code, to interview questions, to codes, so that you have a very logical progression of how you're going to think about your analysis. Okay, now this is just a text of an interview transcript, and you'll see codes on the side. I use NVivo. The point here isn't to read, but what I'm trying to give you a sense is if you set up a priori very well, things can be very easy when you're doing coding. Coding can be a never-ending exercise, right? And it can take months and months and months. But if you start off thinking about how I want to develop a frame, then you can easily say, okay, I'm going to just code this at the beginning and get to this quickness of coding. Someone asked about how do you speed up coding. Start off very well with your theory interviews, and then you think about where you get emergent codes. Okay, so now some best practices on interviewing and coding. So I always, always, always perform mock interviews before you get to the real population of interest. You'll find out some of the things that you think are easy to understand are not understood by the population that you're going to be interviewing, and they actually might help you ask the question better. What better thing to do, right? They'll tell you what to ask when you tell them this is the phenomenon I'm trying to understand. Take notes on nonverbal cues and interesting quotes. I always do that, and I have my mentees do that, because this will help you again with your analysis, right? So, hey, someone says something interesting. You remember that that person says something interesting. When you're looking for a quote to put in your paper, I can go pull up that interview guide that I remember this, right? As opposed to sifting through mounds and mounds of data. And the nonverbal cues can sometimes say that perhaps, and this is another deeper level perhaps for 201, that what they're saying actually is not what had happened, right? By their nonverbal cues. Multiple interviewers means that you have to then kind of have cross interviewer check-ins as they're doing interviewing, right? Is our questions working, our questions not working? And so just remember to do that as well as a best practice. That will help you refine your code, your interview guide and your code book. And then always, and I've outsourced a lot of interview transcription, you have to perform quality checks, right? Because sometimes they just miss things. There's like 2 minutes of content missed, but that was 2 minutes of very important content. Okay, now for coding, as I said, it can take months and months and months. So one way to speed up is to have multiple coders. So that will then require for you to do reliability checks. I often have people do the same interview, right, and code it together, see if there's ways to do this statistically, if there are reliability between those 2 coders, and then let them off do they can do one analysis, one interview coding by themselves. I already mentioned the idea of emergent codes. So now to analysis, so this is where I'm going to kind of put it all together for you, right? So the framework analysis, you have to review code summaries by the domains, the frames that you thought about. And oftentimes as a best practice, and your reviewers, I'll say this other thing. So when I started off, it was very easy to get qualitative work published. Now everyone wants to use these checklists all the time. And I say, well, you know, those checklists are not for me. They're for some novice researcher. But nonetheless, the reviewers will say, you didn't put this in there. So I will tell you that one best practice is to quantify, right, your themes. Okay, technically you don't have to do that, but a lot of reviewers now are looking for that quantification of your themes. Is this a dominant theme? Is it a salient theme? How many people in your sample said that, right? So in any case, try to do that if you can. That will help you give a sense to check your own bias. Say this is a very powerful story, but only 1 person or 3 people said it. Well, perhaps that's not my theme that I'm going to put in my paper. Emergent themes I already mentioned, and then accounting for your biases, right? So I do all my coding now in teams because I might have a specific understanding, but someone else might not. And guess what? You have to prove to your reviewer that that is the correct understanding. So doing it in teams helps you do that. And then independently, I do this sort of, you do your analysis, have code summaries. Did I do the same thing as you did? Do I understand the same way? Then come together with consensus. And then now this is my personal pet peeve. Everybody likes to say, I started with grounded theory, which almost no one does, and they always say I had thematic saturation, which almost never happens, right? So, but that's how you write your papers. I will say, the best way to do that is say a priori. I want the theme of what people said about worship, right, in practice, to be saturated. If you do that a priori, you know when to stop, right? Because there's always interesting things that are never going to stop. But oftentimes people don't know what that is, so they never set up that check, that threshold. So that's one thing. The second thing is oftentimes you have the same group of people that you're interviewing. I always seek out a deviant case, someone totally different, to make sure that I'm understanding, or the phenomenon that I'm trying to describe is accurately described. Okay, again, not for you to read, but for you to understand. I showed you my interview transcript. These are actual quotes, right, that I just drew from my interview summary code notes, right? I didn't have to go back to those transcripts because I said, okay, this person said something interesting about this phenomenon, so now when I'm writing my table in the paper, I already have that. So I'm not spending an enormous amount of time sifting through 45, 60 pages on one person, and I have 35 people I interviewed. But all the things are there, right? And those are the frames at top. That's the theme. I already set it up. I knew my table when I started my interview guide. So that's kind of what I'll leave you. I know I'm running a little bit short on time. Happy to take questions, and I think you're going to bring us home, right, Rama? Yes? Maybe? Maybe not? I don't know.
We've got a good 10 minutes, so.
Okay. Thank you.
Yeah, that's great. Thank you. What a whirlwind tour. I guess I'll open it up. I know that I think we at least touched on most folks' questions that we addressed at the beginning. What questions have come up?
As you're doing your interviews and you're refining your codes, and the questions that you're asking, how many initial interviews do you do before you incorporate them? I've heard different things from like 3 to 5 to 8 to 10.
I think you will probably hear different things based on people's different practices and their comfort levels, and probably also like, I would actually say, for me, it depends on the length of the interview and the depth of the topic. So to me, if you're taking a life history and your interview runs an hour and a half and people are really giving you like very personal information that is hard to digest, I probably would start analyzing and looking at things like more on like the 3 interview range. If you're kind of doing 20 to 30 minute interviews and kind of people are like your group is well defined and people are kind of giving you like, they're talking to you about something that's not necessarily as sensitive, you may want to go a little bit longer. And so I don't think that there's one right answer, but it's variable, I think, depending on your population, what you're getting, and like also kind of your own kind of comfort level. I also think if you're newer to research, I think I would also start, and particularly incorporating people to do it with you on the earlier end to make sure that it's like as a quality control measure, so somebody can kind of say, and I think, in addition to mock interviews, I think it's also good to kind of get feedback on like how these interviews are going so that you can, potentially see if there's any room for getting like richer data as kind of you're going along. So it's better to do that at 3 interviews rather than 15.
The other thing I'll say, so there's at least three reasons you do mock interviews. One is the interview guide, which you mentioned. The other is if you have mentees or junior people, you want to get comfortable, right? So that might be a different set. The third thing is actually sometimes you have a phenomenon like this study. I did my own I had them interview me because as an analyst, I knew all these answers. I knew what I was looking for, right? So there's a sense of my own biases. I want you to interview me so we get a sense of what content I'm going to be thinking about when I look at the interviews and I do my interpretation of the analysis, right? So my interviewers were all Muslim. And so we all had our experiences with our own issues in the workplace. So there's another level, maybe for 201, of why you want to do some more mock interviews of your own team when there's a phenomenon that's really hits close to home, right? So anyway, there's no one answer, but there's reasons for doing it. And then when you feel that I've accomplished that, then you move on.
I'm going to pass this around. We have a Google Drive that has a bunch of resources in it, and so I'm happy to email that to you. But then also, it sounds like some of you have quite a bit of experience in off. One, if you want me to email you the resources, and another, if you're willing to review papers. You don't have to review papers, and you're welcome to tell me if you feel like you're not qualified, but you will be reviewing papers with other people, so you don't have to be the end-all, be-all of qualitative methods to be a reviewer. And then I won't send all of them to Rama.
Is it okay that if we we try to attempt this ourselves or with someone we know, to send it to one of you to kind of look over before we embark on it, like our interview questions and things of that nature? Are you guys open to that?
So yeah, I mean, so I'm certainly open, and I think reaching out to people that you meet usually works. It sort of depends how much work it is, but I do agree that if you're doing qualitative methods for the first time, you should have a qualitative methods mentor, because there's too many little questions to just read the literature or read a textbook and do it yourself. Like, you get a general idea, but you can't tell sometimes from reading a textbook which of these points is important and which of these points is really not that important. And I think that just comes from experience.
I think to extend the analogy, to clinical practice, I can tell you how to put in a central line, but you have to have kind of put in a few central lines to be like, well, how do I rig this, and what do I do with that? And so there is a little bit of muscle memory to it. And so I just want to reiterate the point of having a mentor and somebody who'll kind of walk you through it. But I also think one of the things that is important is to also have people on your team who are familiar with the group that you are trying to study. And so, there are certain, people and populations that I'm much more familiar with than others. And so I think it's not just about the method, but also having familiarity with some of the nuances, like you said, with the community and people who you're kind of interviewing.
I was going to say, too, that it sounds like you might be put in a little bit of a difficult task of being the go-to researcher to do these questions when you're not necessarily qualitative trained, and that it may be better for them to be in touch with a qualitative expert, at least to start out, because I'm sure we've all been in situations where we've been approached to say, hey, I have a qualitative project, you've done it before, can you help us? And it is a little bit difficult to do it in piecemeal. I mean, we'd be able to give you some sort of a little bit of high-level feedback, but really to drive a good qualitative project, there needs to be someone to get you through the process and be involved in depth throughout that process, because it's the thing about qualitative research, and I think quantitative research is the same. You can't really just be like, hey, stats person, here's some data, analyze it for me. I mean, they're like, okay, I can run a regression model, but what are you trying to look for? What is the outcome? And so there needs to be a really in-depth conversation about the fundamental questions, how you're going to ask, because that's going to drive how you're going to get the data, how you're going to analyze, how many coders. And so it needs to be someone who's very involved. And I don't know if you guys agree, but I started out with qualitative research with someone who really knew qualitative research well, and I think that's how I really learned it. Otherwise, it's just really difficult to do that de novo.
The only caveat I would say is that sometimes you don't want a too qualitative researcher. And what do I mean by that? So as I mentioned, I had 3 different mentors, right? And some were from really education specialists, some were from very different backgrounds. And I'm a clinician, and I want to go to this level, not that level, right? And so I'm just being very honest. So you want to pick your mentor well, who can understand the phenomenon of the population. But if you say, hey, I'm going to go to the grand poobah of qualitative methods on my university campus, well, they might be a social scientist who spend 3 months in the field doing interviews, right? And never have a priori hypothesis. Versus someone like me, I don't got 3 months, right, to do that. So just be a little bit cautious. Not that you won't learn something, but you have to choose your mentor in any project. Choose your mentor very carefully.
I don't know if you all remember, but they were talking about how qualitative researchers get really fired up about things, and I think you're seeing that play. No, I'm kidding.
Nonverbal cues are really important.
So I wanted to say 2 things that were related, but a little bit tangential. First, I think we've all sort of touched on, or at least alluded to, the fact that your questions are important, but who you are is also important. And so it's important to have a mentor and a content expert who is asking you those questions, right? So in full disclosure, I was initially primarily quant trained and then came into qual through mixed methods. And so if I am asking residents, what is your experience on shift with central lines, to extend that analogy, I, as their attending, who they're going to see in 4 hours on shift, very different person to ask that question to than a random research assistant they've never met. The other thing is along the lines of like where you come to this work from. So again, like part of that is just being aware. So knowing that like my initial foundation was quant is important. And sometimes that can be leveraged, right? So I do a lot of drawing of like how I think models work, which is frankly more akin to directed acyclic graphs than it is like initially to qualitative frameworks, but it's really nice actually because now I can merge those two and I can, if I'm doing mixed methods, I can pull on all of that and then draw on other conceptual frameworks, and it actually is like a really nice way to come at it from my perspective.
I have the microphone, so I'll keep asking questions. This might turn into a pro tip, but I've actually wanted to get your opinion on this. The transcription is often the most expensive part of things, and we're doing a study right now, and we're using a product that's called Otter AI. I don't want to endorse any specific product, but it actually works really, really well. And we're going back with the person that did the interview and one additional researcher to proofread, and we're listening to audio just to confirm if something doesn't make sense. And it's like $100 a year to do tons of interviews. Do you have experience with that? Is that, especially for the journal perspective, is there any downside to that?
So I think it's fine, personally. We initially used, we have research associates who are undergrads, and just with Otter AI and them, they're still going to get stuff wrong. My first interviews were with physicians, so the language that physicians used, you'd read the transcript and you'd be like, what the heck? And then you'd have to go back and figure out what it was. So even human researchers or human people doing the transcription is not necessarily perfect. So we have, our most recent studies, we've used Otter AI and then somebody reads it and listens again so that there is some quality control. But reading and listening is much faster than doing the transcription, and it's much cheaper than paying for the transcription. So I think that that's totally reasonable. So I think the more that we can use AI, as long as we're double checking it, I think it's totally fine. And then they listen to the whole recording. Yeah, because they're missing the word not, like, can change what the sentence means. So you do have to, you do have to double check for that sort of thing. And then ideally, the people doing the coding did some of the interviews, right? So that so that when they're doing the coding, they're like, oh no, that's not what that person meant, or that's not what that person said. So you have that double check in there as well.
What's the name of that software or that AI? Otter.ai.
Can I just add while we're passing the microphone? I agree that I think using the transcription software is great. I think there's also some variability in how people even transcribe. So if you look at how, nobody here is a linguist, but there's like their transcriptions are like they record pauses and ums and uhs. And so it's also important when you're kind of looking at the transcription to have in your mind like what you're going to kind of clean up. Like most people will clean up pauses and ums and ahs and also like some slang, because some of it is also how you're representing sort of the people, like particularly when you go from transcription to publication, it's also important to think about like how you're going to kind of represent like the people that are giving you information in a way that is honest and respectful as well. So that can kind of be like sometimes people curse or like they say things that are unsavory. So it's important to also think about that rather than just like the transcription itself. So.
Yeah, you can do that on Zoom as well. It's not perfect or anything like that, but if you're planning on going back and cleaning it up. I think that we are close to the end of our time, but if anyone's got any burning questions, you can do that now, or you can catch any one of us at the end. Thank you so much.